Standing tall, an innovative approach for cataract surgery in severe kyphoscoliosis. There are no financial disclosures. A 65-year-old female was referred for cataract surgery to our institute. On examination, her best corrected visual acuity was 612 in the right eye and 618 in the left eye, with normal intraocular pressures. She was a known case of severe kyphoscoliosis and was unable to lie flat on her back for the past 15 years. This is the CT of her spine showing diffuse ankylosis with severe kyphotic deformity of the lumbar spine. There are various challenges in cataract surgery in kyphoscoliosis. The first being inability to recline. Most of the patients have a stiff neck, which makes it tough for the patient to lie down for long. The OR logistics requires modifications, and the surgeon and patient positioning needs to be tackled. Literature review shows standing phacoemulsification is one of the earliest techniques described in 1994. Here, the surgeons use a loop to perform the surgery. Other techniques include use of orthopedic chairs in treadle-like position. This technique increases the risk of positive vitreous pressure. Techniques such as face-to-face seated position or phaco-sit has been described, where the surgeon and the patient face each other. Here, the patient is quite comfortable, but the surgeon acquires quite an unhandy and awkward posture, and the microscope requires to be tilted. Our initial plan was phacoemulsification in standing position due to our experience with the same. The following changes were made in the operating room. First, the table was brought down to the lowest possible level. The head end of the table was bent up to 90 degrees. We added a few pillows for the neck, head and leg support of the patient. But to our disappointment, the height of the table was still too high and surgeon could not obtain a good posture to operate. Now we had to think of an alternative solution. We took two small stools, one for the operating surgeon to stand on and the other for the foot pedal. So, with these 4 modifications, we were confident enough to go ahead with surgery. Phacoemulsification with IOL implantation from an elevated platform. We performed the surgery under topical anesthesia with intraoperative mydriatic agent. Topical anesthesia gave us an advantage, as even though the patient's head was vertical in position, we could ask the patient to move her eye upwards for better field of view. Secondly, we stood in the temporal position, as temporal phaco also gives us better surgical field. Most of the steps were similar to that of standard phacoemulsification, except for the fact that one foot, that's the right foot, was on the top of the stool, so it needed a little practice but was not cumbersome or awkward. We implanted a trifocal IOL inside the back. Intraoperative course of the surgery was uneventful. Patient was comfortable during as well as after surgery. In the post-operative course at 6 weeks, her best corrected visual acuity for near, intermediate as well as distance vision was good, with hardly any aberrations. Using the same technique, she subsequently underwent right eye surgery with good results. To conclude, despite advanced technology and design, our surgical ingenuity may face challenges. Creative approaches, modifications and innovations are essential for success in kyphotic patients. Phacoemulsification from an elevated platform ensures optimum patient comfort. Thank you.